Contrast radiography utilizes various materials like barium sulphate and water-soluble media to enhance imaging of internal structures, aiding in accurate diagnosis and treatment planning. Water-soluble contrast media, both ionic and non-ionic, are injected intravenously for comprehensive imaging of vascular structures and organs, ensuring precise evaluations of various medical conditions. Oily contrast media, such as lipiodol ultrafluida, are specialized for certain investigations, providing detailed visualization in procedures like HSG and fistulography, enhancing diagnostic accuracy. Barium studies reveal radiological terminology like filling defects and strictures, helping identify intraluminal and extraluminal lesions, crucial for diagnosing gastrointestinal conditions and planning appropriate treatments. Diverticulums appear as saccular outpouchings in barium studies, filling with barium to reveal their presence, aiding in the diagnosis of diverticular diseases and associated complications. A normal barium swallow shows a healthy esophagus free from filling defects, ulcerations, strictures, or diverticuli, ensuring no abnormalities are present in the esophageal structure. Corrosive strictures are long, smooth, and often result from accidental ingestion or suicide attempts, requiring careful radiographic examination to plan effective treatment strategies. Achalasia of the cardia presents with smooth tapering of the distal esophagus, causing significant proximal esophageal distension, often requiring further investigation and intervention. Mid-esophageal filling defects seen in barium swallows can indicate esophageal carcinoma, necessitating endoscopic evaluation for biopsy and confirming the malignancy. Hiatus hernia is identified through a barium meal, showing herniation of the gastric fundus above the diaphragm, often correlated with symptoms of gastroesophageal reflux disease, GERD. Gastric bezoars, composed of indigestible materials like hair or plant fibers, appear as mobile intragastric filling defects in radiographic studies, requiring medical or surgical intervention. Linitis plastica, a type of gastric cancer, shows irregular filling defects on barium meals, significantly reducing the gastric lumen and necessitating prompt oncological management. Acute duodenal ulcers are visualized in double contrast barium studies as mucosal injuries with radiating folds, often confirmed through endoscopy for accurate diagnosis and treatment. Chronic duodenal ulcers cause scarring and deformity of the duodenal bulb, creating the classic trefoil appearance, highlighting the need for ongoing medical management to prevent complications. Crohn's disease appears as irregular luminal narrowing with a rose thorn appearance on small bowel follow-through studies, indicating severe inflammation and necessitating comprehensive medical treatment. Ulcerative colitis manifests as a featureless colon lacking haustral markings on barium enema, indicating widespread mucosal inflammation and requiring targeted therapeutic strategies. Sigmoid carcinoma shows a characteristic apple core lesion on barium enema, necessitating further investigation and treatment to manage this malignant condition effectively. Intravenous urography, IVU, is essential for evaluating renal function, urinary tract obstructions, and congenital anomalies, though contraindicated in patients with renal impairment or contrast hypersensitivity. Chronic pyelonephritis presents as a small, irregular kidney with cortical thinning on IV urography, indicating long-standing infection and scarring, requiring medical or surgical intervention. Gastrographin, a water-soluble contrast medium for oral use, is crucial for CT scans of the abdomen and pelvis, aiding in the evaluation of GIT perforations, leakages, and obstructions. Normal lumbar myelography shows well-opacified thecal sac without disc lesions, providing clear imaging of spinal structures and aiding in the assessment of potential neurological issues. Myelography visualizes the salivary glands, revealing any filling defects or strictures, crucial for diagnosing conditions like submandibular duct stones and planning appropriate treatments. Cystorethrography evaluates the urethra and bladder, identifying strictures or abnormalities, essential for diagnosing urinary tract issues and guiding further medical or surgical interventions. Hysterosalpingography, HSG, assesses the uterus and fallopian tubes, identifying anomalies or blockages, playing a critical role in evaluating infertility and planning reproductive treatments. T-tube cholangiography confirms bile duct patency post-gallbladder surgery, ensuring no obstructions are present before tube removal, crucial for preventing post-operative complications.